So viewers, welcome to Science TV News at 7 p.m. My name is Ruth Wairimu and my sign language interpreter is Philip Omondi. So let's focus on today's news and what happened today around the country and locally. Thank you. So hundreds of young people have received funding to start their own businesses. Under the Nyota program, during a launch ceremony held at the Mumias Sports Complex in Kakamega County, the 5-year initiative funded by the World Bank and implemented by the government of Kenya aims to empower more than 800,000 youths across the country. Speaking during the launch, President William Samoei Ruto said over 12,000 youths will each receive 25,000 shillings in the first phase, followed by another 25,000 grant in the second phase. He encouraged the beneficiaries to start small businesses that can grow into sustainable ventures and contribute to the country's economy transformation. Let's take a watch.
Blacklisted. Sasa tuko na wananchi wengi. Wengine walikuwa wananiuliza, wewe bwana president unasema mtu akope shilingi 500, shilingi 500 itamsaidia nini? Sijui shilingi 1000 itamsaidia nini? Sijui shilingi 5000 itamsaidia na nini? Mimi nataka niwaeleze, shida ya biashara si pesa. Shida ya biashara ni akili. Mtu akiwa na akili anaweza kufanya biashara na pesa ya aina yoyote. Na ndio mimi nataka niwaulize, mimi nikisimama mbele yenu, wakati mmoja nilikuwa ninauza kuku na ilikuwa shilingi 13 ama shilingi 17. Leo nasimama mbele yenu hapa kusema siku hizi mimi niko na kuku nyingi, sitaki kusema ni kiasi gani. But I just want to encourage you. Nataka muelewe ya kwamba wale waliosema haba na haba ujaza kibaba, they knew what they are saying. You can start small. Hata Biblia inasema do not despise young or small beginnings. There is a future. Mnanielewa jameni? Kuna watu watakuambia 25,000 haiwezi kufanya chochote. Kuna watu watakuambia shilingi 50,000 haiwezi kufanya chochote. Lakini mimi nataka kukueleza, ukitumia akili, ukijipanga vizuri, 50,000 can make a difference in your life and can grow your business. Na ndio sababu hiyo, I am standing before you to thank the World Bank Group for being our partners so that we can do this together. Pesa ambayo tunawapatia leo ni mkopo tumechukua kutoka World Bank. Mjue si pesa ya bure. Ni mnanielewa? Serikali ya Kenya itakuja kulipa baadaye, lakini nyinyi hamuwezi kulipa. Nyinyi sasa hiyo pesa ni pesa yenu.
The government of Kenya has unveiled a new digital initiative to monitor and record cases of mothers and newborns losing their lives in maternity wards as a part of efforts to enhance accountability and improve maternal health care services. Health Cabinet Secretary Aden Duale announced that all health facilities will now be required to submit daily reports and specify the causes of any maternal or infant deaths through a centralized digital system managed by the Ministry of Health. Speaking during the 4th graduation ceremony for nursing trainees at the Kenyatta University Teaching and Referral and Research Hospital, Duale emphasized that the move aims to ensure no mother or child dies during or due to negligence of lack of proper data management. Let's take.
The Digital Health Act, it is criminal when healthcare professionals either falsify or fail to report any health data through our Ministry of Health Healthcare Information System. And very soon we are going to introduce into our digital health superhighway where every facility, including our referral hospitals and our county hospitals, every morning through our dashboard, the reasons you report, and you must report every maternal mortality and newborn mortality in our country. It's going to be a rule. We know how many babies are born in our country. We know how many of them are reimbursed through the Social Health Authority. Now we want to make sure that no mother who is not a patient, who is healthy, who walks to this facility to give us a living, we are told that mother and her newborn are dead. We will not accept that. It's immoral, it's unconstitutional.
Our next story is human rights groups have criticized, the Kenya government for remaining silent of the growing cases of killings and mistreatment of Kenyans living in foreign countries. The organizations have urged the government to take urgent action to protect its citizens wherever they are. Meanwhile, the family of Okoth Ogutu, a Kenyan teacher who was killed in Tanzania, has appealed to both the Kenyan and Tanzanian government to show compassion and work together to facilitate the retrievement of his body. Ogutu was reported shot dead following the post-election violence in Tanzania, raising concerns about the safety and protection of foreign nationals in the neighboring country. Let's take a look.
Mr. President, please come out and assist us. We need to put a closure to this as a family. We are tortured emotionally, psychologically. Things can't move on. We are tortured. We are appealing for the body of John. Because as at now, we have evidence that John was killed in Tanzania. We are appealing for that body to be brought home.
These conditions essentially produce the conspiracy theories. It produces the concerns that not only have there been massive human rights violations, but also there is a massive cover-up that is happening at the moment. Unverified yet are concerns around disposal or mass burials of bodies. And I think, without access to some of these locations and safe access, unfortunately, the conspiracies and the concerns will continue.
Kenyans working in Tanzania must not be scapegoated by an administration that has violently suppressed civic space. We stand in solidarity with the people of Tanzania in their struggle for human rights, freedom, and dignity. We call upon the governments of Kenya, the African Union, SADC, the East African Cooperation, and the United Nations to act decisively and protect Tanzanians, Kenyans in Tanzania, and other foreign nationals.
And indeed, may justice be granted to the affected family. It's not a good thing. So we hope that justice will be found for our Kenyan brothers and sisters. Okay. Thank you. So let's continue with our next story on agriculture. So Agriculture Cabinet Secretary Mutahi Kagwe has urged politicians to stop using tea prices as a political weapon, saying the challenges facing the tea sector are technical and require policy solutions as well as efforts to improve crop quality. Speaking on Friday, CS Kagwe said the government is working to ensure farmers get fair value for their produce through market reforms and better management practices. He emphasized that farmers are free to sell their tea wherever they can sell, secure better prices. The CS also cautioned leaders against dividing the tea sector along regional lines, calling for unity and cooperation to strengthen one Kenyan's key economic pillars. Let's take a look.
Tea issues are not political, tea taste issues are not political issues. They are technical issues. It is a technical issue. We have also got options. Na tuwaambia watu wa KTDA wafanye hivi. We have said the tea market is also open. It's also open on the internet. Wewe ukiwa na majani yako, usikie pale unauza sio mzuri, it is open for you to sell anywhere in the world.
On to the next news. The National Authority for Campaign Against Alcohol and Drug Abuse, NACADA, has called on religious leaders to take an active role in combating the rising cases of alcohol and drug abuse in Nandi County. Speaking during a public sensitization forum in Kapsabet, NACADA board chairperson Bishop Stephen Mairuri said faith-based institutions play a vital role in shaping societal morals and supporting families affected by addiction. He urged religious leaders to use churches and other places of worship as a platform to raise awareness and lead efforts against the use of drugs and alcohol, noting that the moral guidance is key to restoring communities battling with substance abuse. Let's take a look.
Misikiti hakuna vijana. Je, kesho sisi tukiwa wazee, nani atatumia hizo kanisa ambazo tunajenga? Nani atatumia hiyo misikiti? Kama vijana wetu wote wameharibiwa na mihadarati.
And to help our people. And in helping with that, public education is very key. And the churches and the mosques have the platform to educate their members so that they can educate the community on the dangers that drugs. And when we talk of alcohol here, we mean the bad alcohol. And so that has affected many families. The third generation alcohol has been a menace in central Kenya for many years, and that we are winning the war there, and these people are trying everywhere else in the country.
Let's take a look. For many years, traditional medicine have been largely disregarded by scientific, but this is now changing as Moi University embarks on scientific research aimed at integrating herbal remedies in hospital treatment. In partnership with key stakeholders in the health sector, the university of Moi has begun planting and preserving medicinal trees known for their healing properties as part of efforts to protect endangered species used in traditional medicine. Speaking at the university, Professor Robert Kuremu Tenge, head of the medical center, said the initiative was prompted by concern over the rapid disappearance of such trees due to deforestation and climate change. He emphasized that the importance of safeguarding indigenous medicinal knowledge for future generations. Let's take a look.
Activities around, farming activities and things of that kind, we are losing a lot of, our plant resources. And unless we move with speed to ensure that we conserve them.
Traditional medicine is as old as humanity. And we are happy to work with Moi University, to collaborate with Moi University on this program, because for the first time, we will now have a chance to subject traditional medicine to research.
Healers, to give them specifics of how to apply them, because we need them, and they do a lot of practice out there in the community areas. So once we have done the research and shared with them, we also want to move this a step further, because based on the research work, if we are able to establish plants which are really effective based on their efficacy, then we can work towards actually establishing pharmaceutical products.
We may have missed the boat earlier, but the second boat we are on. So it's the right time now, because it's become very expensive to run healthcare with imported medication. You see, in the realm of health, the research that goes into pharmaceuticals is huge, and therefore the profits that they make also are huge. So make it cheaper for us to run health by looking at the traditional medicines that we have, produce them here in forms that can be utilized by people in the healthcare. You see, currently they are utilized by the herbalists themselves. But you see, to put them in hospital, anybody should be in a position to prescribe and to give to patients and so on.
The modern medicine actually come from plants. So what has been happening is that we are actually losing value as, especially for us in the continent where we have a lot of plant resources. So other people come, harvest, they go and prepare medicine, and then they sell to us. So why don't we do it ourselves?
It's really phenomenal for us to be able to launch this particular initiative of
All right, now let's take a short break and we'll be back with sports news in a few.